perform more than 500,000 hip replacements every year. That number is only expected to increase as our population ages. This is a major surgery that often requires long recovery.
That's prompting more doctors to use an alternative approach in hopes of giving patients better outcomes. Wink News health and medical reporter Amy Osher explains.
Right here at the hip crease.
If you or a loved one needs a hip replacement, expected to take about 4 to 8 weeks to fully recover.
Hip surgery is no small deal.
But there's a surgical technique gaining popularity that's helping people walk on their own up to 6 days faster. It's called direct anterior total hip arthroplasty.
I find my patients really enjoy, getting up and doing the things they want right after surgery.
Surgeons make a small incision about 3 to 6 inches long near the front of the hip, guided by real-time x-rays like these. They move muscle tissues aside instead of cutting through them like in traditional procedures.
So when we replace the hip, we're replacing the socket and the ball. So
then they implant the artificial hip.
Theoretically, there's no muscle healing that needs to happen. Patients are usually up and about the day of surgery, if not the day after surgery,
leading to a faster recovery.
This is her about 6 weeks after surgery.
Amy Osher, Wink News.
Plastic liner.
Doctors warn this approach is still surgery like all others. It carries risks. So by talking with your doctor, you can decide whether this may be the right option if you're considering hip replacement.